Again, welcome to the Parkinson's Foundation's PD Health at Home Wellness Wednesdays. I'm so glad you're here. Today, we're going to be offering a webinar on how exercise can transform the life with Parkinson's. We move our bodies to improve our mobility and our mood and so many other things in our lives as humans living with Parkinson's disease. So, thank you so much for being here to learn more about the impact of exercise and movement living with Parkinson's. Before we get into it, I want to remind you about our other PD Health at Home virtual programs. Each week, we offer sessions tailored to support people with Parkinson's and their care partners. That includes our Mindfulness Mondays session, Wellness Wednesdays, Fitness Fridays, care partner programs, our expert briefings, and Spanish language series, EP Saluda and Casa. Be sure to visit our website to see what's coming up next and explore archive videos on YouTube. Our next Wellness Wednesday will be our Coffee and Conversation series, and we'll be focusing on the subject of depression, anxiety, and apathy. These coffee and conversations programs are not presentations. They are moments to ask the physicians that we invite into this space the questions that are most important to you related to the subject around depression, anxiety, and apathy. So join Dr. Sneha Mantri and her co-facilitator to answer the questions you have related to that subject around depression, anxiety, and apathy. It's a great way to ask the questions that you may have between doctor's visits and also to connect in community. So I hope that you'll join us next Wednesday for our Coffee and Conversations with Dr. Sneha Mantri. PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. Thank you, Light of Day. And now I'd like to introduce our expert presenter for today's Wellness Wednesday, Dr. Bethany Althouse. Dr. Althouse is a doctor of physical therapy, clinical supervisor in South Portland, and co-director of clinical excellence. She's a board-certified clinical specialist in neurologic physical therapy, certified in vestibular rehabilitation, and PWR moves, trained in Parkinson's wellness recovery. She brings extensive experience across inpatient rehab, skilled nursing, and community-based neurological care with a strong focus on helping individuals improve function and achieve meaningful personal goals. We're so grateful to have your expertise with us today. Please join me in welcoming Dr. Bethany Althouse.
Thank you so much, Krista, for that introduction. I'm just really honored to be here and talking to you all about this subject. Um, it's something that I could talk about for hours and hours, so I am going to try to keep it brief today. But we are going to try to get into the real nitty-gritty of what exercise really does when you're living with Parkinson's. We're going to start out by explaining exactly from like a biological standpoint or molecular standpoint what the effects are on the brain, on symptoms, on overall health and mood. We're going to go through what high intensity actually means. I want to make this really practical, really accessible for everyone listening. And I want you to be able to come away from this presentation with some really tangible things that you can start to implement today. We're going to identify the key types of exercise that provide the greatest amounts of benefit, and provide some really like simple, realistic strategies, again, that you could start using today to incorporate those things into your daily life. And some tools additionally to help stay motivated, because we all know that that can be a big challenge for all of us. So without further ado, let's get right into some pathophysiology. So like I said, we're going to get a little deep here, and then I promise to bring it back into some more tangible things in a few minutes. But I do think it's important to understand what's actually happening in the brain to understand what exercise is really doing for our brains here. So I have two pictures up here. Um, it's important to, as most of you probably know, understand that Parkinson's disease happens when brain cells that make dopamine are dying. And that's disrupting a part of the brain called the basal ganglia, that helps us with our movement. So I want to break this down into four main parts or problems that are happening at the same time in Parkinson's disease. So the first is a protein problem. So there's a protein in the brain called asynuclein, and that, to bring it down to its most basic level, is essentially getting more sticky, and those proteins are clumping together in the brain, and damaging brain cells. So that's problem number one. Problem number two is an energy problem. So the cell's power plants, or what's called mitochondria, are breaking down. And as a result of that, the cell actually just doesn't have as much energy and also is creating this harmful waste, which is called a process called oxidative stress. Problem number three, and this is the one that's probably the most well known, is the actual shortage of dopamine itself. So, when those dopamine producing cells die in an area of the brain called the substantia nigra, and that's what's pictured in that first image on the slide, that is what causes slowness in movement, so the bradykinesia. It's what causes stiffness or rigidity and also tremor. So a couple of those like really classic motor symptoms that people with Parkinson's experience. And then a spreading pattern. So the disease starts in the lower brain. And this is why oftentimes those first symptoms that people might recognize are actually not motor at all. They are things like loss of smell or interruption to sleep. That's what we experience first. And then as this kind of moves, this problem moves up into the basal ganglia in more of the center of the brain. That's what's causing more of those movement type problems. Okay, so let's dive in because the basal ganglia, that portion of the brain in the center that you can see in the image there, um, we said that's where movement is really being sent out to different areas of the brain to help us move in what we would consider a normal way. So the basal ganglia is essentially acting like a traffic controller for movement. So there's two different pathways that go through there. There's the direct pathway, which is the green light or like the go to tell your body to move. And then there's the indirect pathway or like the red light, the stop, saying, okay, we need to stop movement. Normally, what dopamine does is it keeps those two pathways balanced. Um, so without enough dopamine, the red light is becoming too strong for that stop of the movement, and the green light is too weak. So that's where movement becomes slow and difficult. So bottom line, if we're breaking this down, key point, sticky proteins plus those failing mitochondria is leading to dopamine cell death, basal ganglia imbalance, and then movement problems. Okay. So let's dial it in a little bit, and just review some common risk factors because I think these are also important to understand as we talk about the role of exercise. So most of these are probably fairly familiar. We know that age, certain medications that you may be on can cause Parkinsonian features. The misfolding of the brain protein, so that asynuclein. We know that there are some links now to environmental causes, exposure to metals, herbicides, pesticides, some of those things. We know that there's a portion of this that's thought to be genetic, like 10 to 15% of cases is what they estimate now. And something a little newer that's come on the scene is a history of head injury or trauma. Okay. All right. And then symptoms. So these are the symptoms that we're going to be discussing throughout this presentation. Again, most of these should look, pretty self-explanatory. So I'm not going to focus on the ones that are on there. What I wanted to actually call a little bit more attention to were the non-motor symptoms here. And one in particular being autonomic dysfunction, which is really common, and an important non-motor feature of Parkinson's that we need to identify here. So, autonomic nervous system is really talking about like the role of the sympathetic nervous system, so that like fight or flight system in our bodies. It's impacting many, many different symptoms, or different systems, sorry, like your cardiovascular system, your gastrointestinal system, urinary, sexual, thermoregulatory. It has an impact on all of these. The most prominent symptom that we see from this change in the autonomic nervous system is what's called orthostatic hypotension, or that drop in blood pressure that can happen in some people living with Parkinson's, that is especially prominent as we're changing positions. So some of you may have experienced this, especially when you're going from like a sit to a stand or laying down to sitting up. You might recognize that kind of drop in pressure that can cause lightheadedness, dizziness, some of those other types of symptoms. And they estimate that this is present in like 20 to 50% of cases. And I bring this up because can be something that really stands in the way of exercise. And it's an area where a physical therapist that's trained in and specializing in Parkinson's disease can really have a big role, both with treating that conservatively, working with you to make sure that an exercise program is safe and effective if you're having issues like this. Um, and also working in tandem with hopefully a movement disorder specialist that's on your team, because we know that these things can be barriers to participation, as can urinary dysfunction, right? So all of these things are things that we're thinking about. They're things that can be helped by exercise, but also recognizing that a lot of times you may need a trained professional, to help make that exercise program individualized and safe for you if that's something that you're living with. The other thing that I wanted to recognize here is that non-motor symptoms often are appearing, they give a pretty wide range here in the research, but 10 to 40 years before those motor symptoms. So these are really important things to pay attention to and that often go unrecognized because people aren't connecting them necessarily to Parkinson's disease. Um, the other thing I wanted to draw attention to is that almost all Parkinson's patients experience non-motor symptoms, and psychiatric symptoms are tend to be the most common. So while the motor symptoms are often like what we think about first and are thought of as defining the diagnosis, the non-motor symptoms, if you look into the research and think about this, actually sometimes will have a greater impact on quality of life. So important, really important to note and to think about here. Um, and as we start to talk about some of those non-motor symptoms, I just have some stats here that I won't dive too deep into. But apathy, impacting a great deal of people, depression and anxiety. And this all, I promise, becomes important because we're going to look at specific kinds of exercise that can help with each of these things. Okay. So, how does exercise improve Parkinson's symptoms? Whoop, I'm one ahead. And I apologize, it looks like some of the text is missing from this slide. But Parkinson's disease is impacting everyone slightly differently, right? So we know that no two people are going to present exactly the same. And so, like I said before, every exercise program should really be tailored to you. So I want you to walk out of this session today feeling not only more knowledgeable about Parkinson's disease, but also feeling like you have some control over this, because you do. And yes, we know Parkinson's is progressive, but there is really robust evidence now that shows that exercise can um, not only change the symptoms that you're feeling, but there's really robust evidence that it can actually slow down disease progression. And that's what we're going to talk about next. So, we're going to talk about some motor symptom benefits of exercise, both clinical and what we would call neuroprotective. So, actually protecting the processes that are happening in your brain. We're going to talk about non-motor symptom benefits, and then finally that disease modification piece before we move into specific kinds of exercise. Perfect. Okay. So, neuroprotective. So, again, protecting the brain, protecting the processes that are happening there. Um, the first part of this neuroprotection in exercise is something called exerkines. So it's a big fancy word, but they are essentially protective molecules. So when you're exercising, your muscles actually release this protective molecule. It travels to the brain and it helps restore mitochondrial function, so that cell energy source. It also helps to reduce inflammation that damages brain cells. So we know that this is something from previous studies that can help just with aging process in general. But this becomes even more important in something like Parkinson's disease, where we know there's extra things going on in the brain, extra processes going on that are making those systems break down a little bit faster. The second part of this is the dopamine transmission. So, exercise is not necessarily increasing the amount of dopamine that you have, but it's enhancing your body's ability to use the dopamine that you have more efficiently. Um, the dopamine signaling is heightened in the basal ganglia. And in addition to that, it's helping to form new connections between brain cells. So that's essentially helping to compensate for that loss of dopamine. We have increased brain connectivity. So they've done some brain imaging studies showing that exercise actually improves communication between basal ganglia, that section of the brain most impacted in Parkinson's, and the cerebral cortex, those areas that control movement. Better connectivity means better motor function. So X equals Y. Reduce brain shrinkage. It's promoting new brain cell connections. It's basically slowing brain atrophy. We know this. Improvement in that mitochondrial function. So exercise is helping to make new mitochondria and also helping to remove the damaged ones, which is restoring that energy production. And then finally, reducing inflammation. So again, in many, many studies, they've shown that exercise actually decreases neuroinflammation by reducing the amount of those asynuclein or those protein clumps that are happening in the brain and lowering inflammatory signals that can contribute to neurodegeneration. So all of these mechanisms together are working to protect our brain. And now let's take that into a little bit more of a clinical side of things. So, clinical benefits of exercise, and this is where it gets really, really exciting. So, they've shown that high intensity aerobic exercise, so we're talking like 70 to 80% of max heart rate. This is high effort level, actually stabilizes motor symptoms over the course of 6 months. And this was in a number of studies that they looked at. So it's not just improving symptoms, it's actually stabilizing the motor function. While control group showed that expected disease progression. Um, so really, really robust evidence that exercise is actually maybe slowing the disease progression itself. And I wanted to highlight a couple of other things that are a little bit more specific to certain kinds of exercise, and we'll dive a little deeper into this in a minute. But dance and gait and balance training show the largest motor improvements. Resistance training improves strength, balance, mobility, and freezing of gait at the highest level. And interestingly enough, combined aerobic and resistance training, and they did this 3 times a week for 12 months, provided the greatest motor improvement, which was shown to be better than just the aerobic exercise alone. And this is what you'll see over and over in the research now, is that combination training, which makes sense, is better than just aerobic training by itself. Um, there are a couple of recent studies. A lot of this is from a study actually that came out at the very end of last year that community activities, so we're talking like rock steady boxing, tai chi, dance, climbing, are incredibly effective and also have the social and cognitive benefits that we might not get from a home program. And all of the studies in the last 5 years have shown that exercise is safe, no serious adverse effects reported. Of course, again, everyone should be talking to a professional. We know that people have some comorbidities, right? That can pop up all the time. So it's still really, really important to check in with your team, and make sure that you're exercising in a way that's safe for you. So I can't emphasize that part enough. Okay, let's talk a bit about non-motor symptoms now, because I think this is where people might not be as familiar with the research. So let's talk about sleep, because I know this is a really hot topic. So I looked at a whole bunch of studies on this, and the one that I wanted to point out was actually a study that came out in 2025, so just last year. It was a meta-analysis that looked at a whole bunch of different studies, 62, um, and found that exercise significantly improved sleep quality. They found that high intensity training improved sleep efficiency and also deep sleep. So we know that there's changes being made here. There's still a lot of research left to do, but the evidence that we do have really points to the fact that sleep quality is improving, with especially high intensity exercise. And there's a couple others listed too that they've studied. Um, Depression. So again, multiple large scale studies showed a large antidepressant effect. I think an important finding here was that again, they found that combined exercise programs, so mixing like aerobic, strength, balance together, significantly better than aerobic exercise alone. They also found that dance was particularly effective for improving depression symptoms, which I would make an argument here, that probably the people that were participating in that program, that was a meaningful activity for them. And so I think what we can kind of take away from that is we want to be doing activities that are meaningful to us, right? Because that's what's going to keep us the most consistent with our programs. And then finally on here, anxiety. They found that yoga and Tai Chi are actually the most effective in targeting anxiety specifically, and that mindfulness yoga was better than a conventional stretching and resistance training program. So there's really robust evidence that some mindfulness, some relaxation, Tai Chi, yoga, those kind of slow movements can be really beneficial for these non-motor symptoms. Okay, I'm gonna go through a couple more. So cognition, this is another one that I get a lot of questions about. Again, I'm gonna sound like a broken record, but I think it's important to know combined exercise programs show the best cognitive benefits. Interestingly, here, the ones that were at least 60 minutes, so like a little bit higher duration, showed the best benefit. And it was much better than just aerobic or just strength alone. Those didn't show significant impact on cognitive function. Um, Fatigue, this is another major thing that we hear from a lot of our Parkinson's patients. Um, about half of the people in the studies that I looked at were saying that exercise helped their fatigue. Found that multiple types of exercise here worked. Tai Chi, Qigong, high intensity interval training, boxing really didn't matter. Again, key finding is just that it has to be something that you enjoy and that you will stick with. I think that's the main takeaway. And finally, quality of life. This one I found kind of interesting as well. They actually found that aquatic-based training showed the largest improvement in quality of life. And they surmise that this might be because when you're in the water, there's not as high of a fall risk. It might be reducing pain levels as you're in the water. You know, there's some buoyancy, less joint stress, and still allowing full movement. So kind of an interesting finding there. And the water can be a great spot to get still a high intensity workout in. So this will be in, these charts will be provided if you guys ever want to look back at these, because there's a couple of really nice studies that are out. It's really fun to look at the evidence behind this because almost all the evidence that we were looking at has been within the last 5 years. So that really goes to show we've come a long way with this research, but there's still so much left to study here. All right. And then disease modification. So this is the real question, right? Can exercise actually slow disease progression? And I would say most of the experts are along the same line of thinking that yes, based on all of the research, we have really strong levels of evidence that exercise can slow disease progression. They just haven't necessarily found a biomarker for this yet. But they have been studying this for a while now. So again, I'm going to repeat this stat again because I think it's so important to remember. They found that motor symptoms stabilized over 6 months with exercise instead of that expected decline. And I have a diagram of this that's really powerful in my next slide. But it's essentially suggesting, right, that the benefits of the exercise go beyond just symptom relief, but actually changing the course of the disease. So I think it's important to note here that if we talk about medications, so we talk about like Cinemet, some of those things, those are certainly helping with symptoms, but they are not changing the course of the disease process itself. So right now, exercise is the only thing that we really know of through the research that's changing the course of the disease. So really powerful evidence here. Um, I think it's interesting as well. So prevention evidence. Active lifestyles were linked to a lower risk of even developing Parkinson's. And there's some really cool trials that are going on now that are testing exercise in the like pre-diagnosis phase of Parkinson's to preserve the neurons. So that's where research is going next. But I think through all the research that's out there right now, so again, like level 1A evidence um, that we should be prescribing exercise as medicine as early as we can for people living with Parkinson's or even have a family history of Parkinson's. Um, any risk factors, we really should be encouraging this type of exercise. All right. And this is the chart I was talking about. And I think this is a really powerful visual of everything that we've discussed so far. So you can see on we're measuring motor symptoms here. Traditional course of PD, that line just kind of goes up. So symptoms are worsening. Um, exercise after the green line is people who started exercising after they were given the diagnosis. And you can see there's still a really big effect size there. So they're still coming out with less motor symptoms than that traditional PD course. And then finally, our regular lifelong exercisers, even better. So we're seeing the benefits of exercise kind of no matter when you start. It is never too late to start. Today is the best day to start this. Okay. And then this is just to kind of put it all together for you in terms of the benefits, both from symptoms as well as prevention, therapeutic benefits. So just a nice resource to kind of look back at, but essentially illustrating all of these different things that can be impacted by a healthy exercise routine. All right, so let's get a little bit more into the types of exercise themselves and what the current recommendations are for these types of exercise. So three main types of exercise that we're going to talk about today. We're going to talk about aerobic training, resistance training, and balance training. So I've given some examples of what each of those might look like. And then we will get into the specifics based on the research of what is actually recommended, because I think this is where people can feel a little lost, not really know exactly what they should be doing. Okay, so let's see if this one wakes up for us. There we go. I think you can see that now. So you should see on this slide what's called the FIT principle. So as physical therapists, this is what we use to prescribe exercise. So FITT. So we're talking about frequency, intensity, time, and type. And then the specific here, right, is how often should I be doing this type of exercise? How hard should it be when I'm doing it? How long should I be doing it for? And what kind of exercise? And those are the principles that we're going to go through for each of these different kinds of exercise. And we're going to start out with aerobic. And I can't talk about aerobic training without talking about like one of the first big studies that was done on this for people with Parkinson's, and that was the Sparks 2 trial. So they took individuals with Parkinson's, but who were early in disease course and were unmedicated. They exercised for 6 months, 4 times a week. And you can see the protocol that they did. So 5 to 10 minutes of warm up, followed by 30 minutes at that individual's target heart rate, and then 5 to 10 minutes of cool down. And they split them up into different categories. They either had them exercise at a vigorous intensity, a moderate intensity, or a low intensity. And I'm going to share some of the specifics of that. So you can see on the bottom the result, right? Those who exercised at the higher intensity saw less decline in their motor function over 6 months. But I think it's interesting to look at specifically what did that mean. Um, so oftentimes when we're talking about motor severity of motor symptoms, we're using something called the UPDRS score, which some of you may be familiar with. That typically is out of 108. Um, and the higher score is equivalent to a higher level of disability. And what they found was that those scores increased by, for the vigorous intensity group, only zero point 0.3, so a really, really small amount. For the moderate intensity group, their scores increased by 2, still pretty good. And then for the low intensity group, it increased by 3.2. So, benefit no matter what type of exercise that you're doing, but you can see here that really it highlights the impact that being able to exercise at that higher intensity has on the size of the benefit of what you're getting out of this. Okay. So aerobic exercise. So the American Heart Association tells us that we want 150 minutes per week of moderate intensity exercise or 75 minutes of vigorous aerobic activity. Or a combination of both is also fine. We know that based on the current research, to be able to see improvements in motor and non-motor function, we want at least 30 minutes of moderate to vigorous intensity at a frequency of 3 days a week. Over and over in the research, we see no form of aerobic exercise seems to be more beneficial than another. And I get that question a lot, and I think it's an important one. Um, so I'll read again. None is more beneficial than another. You have to do what you love to do. The only thing I would put in there is that it also has to be something that's safe for you. So just thinking about that, the best type of exercise is going to be the one that you love to do. So whether that's cross-country skiing, biking, um, running, walking, whatever it is, we just want to make sure that we're finding a challenge, a level of challenge there that's appropriate. Um, the next thing that I want to go over, because I think this makes it a little bit easier to understand implementing this in a home setting, is how to even know what level of intensity you're exercising at. This is tricky if you've never done it before. So you have two options here. And the first I would say is most appropriate, especially if you're on any type of medication that's blunting your heart rate response. So like a beta blocker or anything like that. We want to use this rate of perceived exertion scale, because it will be more accurate. So scale of 0 to 10, not super complicated. Um, but you're rating as you're doing this type of exercise, how hard is it for you? How hard are you working? And usually, as PTs, we want you somewhere in between that 4 and an 8. So you can see we're in the like somewhat heavy to pretty heavy exercise here. And that would be that like moderate to higher intensity exercise. And then option number two would be to actually do a calculation to find your max heart rate. And the easiest way to do this is to do 220 minus your age. That would find your heart rate max. And then you're just multiplying that by the percentage that you're looking to achieve. So if you're looking to achieve a moderate intensity, we're looking in that 60 to 65% range, and then vigorous intensity, 80 to 85%. Okay. Apologies for the weird way that this came through on the slide. Um, But 60 to 65% of your heart rate max for moderate intensity, as we just said, or translating to a 4 to 6 on that rate of perceived exertion scale. You can still carry on a conversation, but you're definitely breathing heavier. You're starting to sweat. And one example of this is doing 30 minutes, 5 days a week. So again, we probably want a little bit more volume if you're exercising at that lower to moderate intensity level versus a vigorous intensity. So examples of this might be like a brisk walk, riding a bike on a flat surface, a paved path, things of that nature. Okay. And then vigorous intensity, 80 to 85% of your heart rate max, or 7 to 8 on the RPE scale. Your heart is beating a lot faster. You can have a conversation, but you shouldn't be probably speaking in like full sentences necessarily. You find yourself pausing to take a breath. And you can see examples of this might be like running, walking up a hill, hiking, swimming laps, or maybe even like a high intensity interval training. And a more relevant example of that might be like 15 minutes, but you're doing it 5 days a week. So a little shorter in the duration there because the intensity level is higher. Beautiful. And I wanted to put a little spotlight here on the high intensity interval training because I think this is something that a lot of people are not super familiar with. It can feel very intimidating. Um, Especially if you've never done it before. But it's been shown time and time again to be feasible and safe for people living with Parkinson's. It just might look different for where you are in your fitness journey. So typically, though, what we're looking for is really short bursts, so like 1 to 2 minutes. You're looking to be at that 90% max heart rate and then a recovery, so a low intensity or even sometimes like absolute rest recovery. But your sessions are short, they're only like 15 to 20 minutes. So sometimes with patients, right, this can improve in adherence to it or consistency because it's not taking as long to do. There's also, you can read on here, there's a lot of great evidence behind it, um, versus moderate and continuous training that it actually has greater gains in muscle strength, in aerobic capacity, muscle mass, functional outcome measures, everything kind of improves at a quicker pace when you're doing this higher intensity. Now, I want to just go on the record and say that I understand everybody is at a different level in their current level of fitness and how comfortable they feel exercising in general. This is not necessarily where we start with people, right? So it's important that we start you at a level that feels comfortable and realistic for you. And so what I mean by that is a lot of times when I have patients come into the clinic, and exercise is really intimidating, especially high intensity training. And we work on this together, and we might be starting at that low to moderate intensity level. And maybe it's 5 minutes a day, but starting there and then working to progress. So it's not like, jumping immediately into high intensity training is not always the best answer. So this is another spot where I would say, we know the evidence is there, you know what you're working towards, but oftentimes it will take time to get patients to this level, as well as sometimes some skilled physical therapy to make sure that that program is safe and feasible. Let's talk a bit about resistance training. So, we know the benefits of resistance training, right? It's going to improve your strength. We talked previously about it improving non-motor symptoms, the motor disease severity, balance, walking speed, fall rate, all really, really important things. And if we're bringing this into those fit principles, what they're recommending now is 1 to 2 times a week, moderately challenging if you're doing 3 sets of resistance training exercise. Um, you shouldn't feel like you could do more reps after that third set. You should feel fairly fatigued in that muscle. 30 to 60 minutes, so pretty big range here. And the fun part of this is that you don't necessarily need a lot of equipment to do it. So, maybe you have some weights at home, maybe you have some resistance bands, but body weight is incredible. You can do a lot just with your body weight. Exercise class is also great for this, but it can be simple. So, one of the things that I bring up here as an example is a sit to stand, right? Something that is really scalable depending on what level you're at. We can add or subtract from the challenge of that, but that is a sit to stand is resistance training. So simple, can be very, very simple here. Okay, and balance training again. I apologize that this came through so weird. Um, So balance, benefits of balance training, walking balance, again, non-motor symptoms, quality of life, and balance confidence, which we know is really important. 2 to 3 times a week is recommended. We want to hit that moderately challenging level if you're not in a skilled PT session, right? So we don't want really low intensity, things that you're already good at. Are not going to meet that challenge level to drive balance and push balance to a better place. So it should be moderately challenging, but still safe. And a lot of times we talk about like positioning to make balance exercises more safe, putting you in a spot where, if you do lose your balance a little bit, you have something solid to put your hands on. Things of that nature can really go a long way. We're talking 45 to 60 minutes, balance, yoga, tai chi, all of those things. Now, the balance training, or if you're sitting in your chair thinking right now, okay, if I add up all of the minutes that Beth has just talked about, um, that's going to be my whole week. There is absolutely no reason, and actually, I would recommend that these things should really be combined. So let's take that high intensity interval training for a second. Um, I teach a community class here in Maine for people living with Parkinson's. And what we do is we set up this circuit-based training using that like 2 minutes on, 1 minute off setup, but we are combining. So as we go through the circuit, we're getting people's heart rate up, so we're getting some aerobic conditioning there. Um, we're doing exercises that are challenging balance, but are also challenging, resistance training. We're getting everything together. So these things can overlap. It doesn't have to be 60 minutes of just only balance training. It can be balance and resistance training, and you're getting your heart rate up. So don't think of this as something that's just feeling really unattainable. Okay, and then before we close today, I want to go through these 2 slides. Key points to remember. So we're going for as high of a physical effort as we can. So again, I would like to come back on that, like that might be low intensity to start with, and that is okay. But you don't improve by doing what's already easy. We want emotional engagement, so we're choosing meaningful activities that matter to you so that we can keep that motivation level going strong. Ideally, we want some sort of cognitive challenge. So we're talking dual task, like doing 2 things at one time, coordination of challenges, and just novel movements. So we want to switch things up so you're getting new movement sequences and your brain is having to work to adapt to these new situations, can create a lot more resilience. Attentional focus. So this is something that if you're familiar with power moves theory, we're really trying to draw attention to your movements using what they call boosts. So breath work, really hand movements, a loud voice, visual tracking, really can help to optimize the benefits of the exercise that we're doing. Building a routine. So I can't say enough about this. Consistency is so key. So scheduling exercise like a daily appointment to make it a habit. Um, Exercising with other people. I'm going to give some tips on the next slide about that. And then just remembering like something is always better than nothing, right? So if we are starting at 2 minutes a day, 5 minutes a day, whatever it is, every single movement counts. Low intensity exercise counts. And it provides benefit even when high intensity isn't possible. Okay. So just because we keep quoting high intensity is the best doesn't mean that there is no benefit from low intensity. There definitely still is. And we all have to start somewhere and always listening to your body, of course. Um, some tips here for some successful exercise. So again, I can't hammer this one enough. Choose something you enjoy. You're more likely to stick with it. Partner up, mix it up. Variety is good and it reduces boredom. Plan ahead, schedule your exercise, treat it like a meeting. You can see here, this is actually my exercise class here in Maine. So fun. Join an exercise class, especially if it's Parkinson's focused. Um, the socialization really just increases the enjoyment. Everyone always leaves there smiling. The hardest part is actually not the exercise itself, even though we're doing high intensity training. The hardest part is just getting yourself there. Okay. So finding that routine and something that really fits for you is so important. And then tracking it. So seeing your results and seeing your improvement can really help make you feel accomplished, um, and inspire you to continue. Perfect. And then just to wrap up here, I can't help but say physical therapists are movement experts. If you can, it's really so beneficial to find yourself a physical therapist who specializes in Parkinson's. We can help so much with creating an individualized program for you. The other thing here that I think is really important to note is I think it's um, really special and important to be able to form a bond with your physical therapist. I wholeheartedly believe that, everyone living with Parkinson's should have a PT on their team, just like you have a PCP or a movement disorder specialist. Um, we here at the Balance Centers practice what's called longitudinal care for people with PD. And that just means that when someone finishes a course of care, we don't say, okay, see you never, bye. Typically, depending on how that person is doing, we might say, okay, I'm going to see you back for your check-in it could be 3 months, it could be 6 months, it could be a year, depending on how they're doing. So we're always having these check-ins, and oftentimes we can detect change or decline before people even really notice, right? So we're intervening before catastrophic events happen, such as a fall. Um, it also just helps us identify ways that we can help you, ways that we can progress your program, modify your program. So, so important. Um, and of course, can help combat specific difficulties that you may be having that may be standing in the way of exercise, like freezing, or some of those autonomic systems that could be going awry, like orthostatic hypotension. So a lot of benefits of having a PT on your team. And finally, I'll just say, living with Parkinson's doesn't mean that every symptom that you have is coming from Parkinson's. And I think that's an important thing to remember and to have someone on your team who is willing to screen and test for other things as well. Because, at the same time as having Parkinson's, we're also aging. There's so many other processes that are going on, um, that it's important to keep that in mind. Thank you guys so much. I really appreciate your time and I'm happy to take some questions.
Thank you, Beth. I'm just getting oriented to the Q&A here. So give me just a moment as I was sharing screen.
First.
So we're going to take questions specifically related to exercise and its impact on Parkinson's related symptoms. I'm curious if you could give us some examples of what resistance training means. What do you mean by resistance training?
Yeah, so resistance training is anything that's building muscle mass. So when we're talking about resistance training, we want to think about things like using TheraBand, body weight exercises. small weights at home, things of that nature. So I think the one example that I gave in the presentation was like a sit to stand, something pretty standard. But you're using the resistance of your actual body weight itself. And that can be for upper body, that can be for lower body. So thinking about like simple body weight resistance training that could be used at home would be a circuit of like a sit to stand, a modified push up on the wall. Maybe you have your TheraBand and you're doing some rows, anything that's getting those muscles working where we're thinking like sets and reps for that, right? So things that you would be doing, okay, 3 sets of 10 of those sit to stands, that's what we're talking about there. The other thing that we didn't talk too much about with the resistance training is that we also want to make sure that we're taking adequate rest between the sets as you're doing this. That's a mistake that I see really commonly happening. The magic in resistance training and stressing those muscles is giving them the rest in between.
I see. Great. So get my resistance bands out.
Get your resistance bands out. Yeah.
We have a question from Dave about pickleball. Just
Love it.
what about sports like pickleball? I mean, what's your impression about pickleball and how
Yeah.
it benefits symptoms of Parkinson's?
100%. So I've seen some really incredible programs, even where we are here in Maine. We have someone that does pickleball for Parkinson's. I think it's wonderful. So the great thing about like pickleball, tennis, things of that nature is it's exactly what I was talking about in that presentation. So it's a combination of things. Most often when you're playing, right, you're getting agility, you're getting some coordination training, you're getting like cognition, socialization, your heart rate's coming up. So I think pickleball is one of those really excellent choices for something that you're going to enjoy and you're probably going to stick with because it has that social aspect to it. But definitely, I would put that under the category of combination training, which is highest level of benefit. So, yes, definitely.
Hmm. This is an interesting question. Do you consider golfing exercise?
Yes. I would say it probably heavily depends on the way that you're doing it. So oftentimes when I have patients who really want to golf, if walking is something that's safe and feasible, that can be, some great resistance training, maybe carrying the bag for part of that way. Um, just like walking on uneven terrain, you're getting some balance in there. Definitely, you're getting big, powerful movements. So even like going to the driving range has a definite benefit to it. Again, you're getting like, um, hand-eye coordination, absolutely. I think that it's also an activity that you can tailor quite a bit depending on um, what level of intensity you'd like it to be at. But yes, I think there's a ton of benefit there. Anything where you're getting a lot of power out of movements is really good for Parkinson's.
Great. I know in my gym we do what's called golf swings, and it's hard work.
It's really hard work.
It's hard
Yeah.
work. Yeah.
Yeah, and I think you'd be surprised, like someone at the driving range, if you're really going at it, you can get your heart rate up there as well.
Yeah. Yeah. This is an important question. What if you're starting late on your exercise journey? Can your symptoms improve over time, or do your symptoms seem to like stay the same?
No, there's pretty robust evidence, and I would say clinically what I see a lot is that people can absolutely improve. Number one, it doesn't matter when you're starting. We've clinically seen that people have improved. I don't know that there's like specific research studies on like specific times that people are starting in the course of that disease process and like what the benefits are. I don't think we've gotten that far in the research.
Mhm.
But we see it all the time. And in fact, a lot of the time when we see people that haven't been lifelong exercisers and maybe are starting, later than they wanted to with exercise, um, the benefits are really twofold because you're not only getting the benefits with all the things that we talked about that are Parkinson specific, but also just normal aging process. And I can't say that enough. Like, as you start to exercise, you're going to also be combating the age-related decline that happens. And so oftentimes in those people, we see a significant amount of progress, especially up front. So it's truly never too late to start this.
It's inspiring, Beth, to know like this is a medicine you can start at any time. At
Yeah.
any time in your journey of living and with Parkinson's. So thanks for empowering us to, I like to say step on my mat because I'm a yoga teacher, but go to the gym to take that fitness class, to try something new or to
Absolutely.
consult with a physical therapist. So I appreciate that inspiration. Okay,
Absolutely.
Colette, this is a question Colette's asking, and I'm really curious what you're gonna say. Does yard work count as exercise?
Yeah. Yes. My first question would be, do you enjoy it? But I know sometimes there are things that we just like have to do. And yes, absolutely. So that's something that, especially if you're going to go into it and do it really mindfully, yeah, you could do your yard work. I'm thinking specifically about like raking leaves. That could be interval training, right? So pop on your whatever you're using to monitor your heart rate. Try to get into those ranges. Set yourself a goal based on where you're at right now. Okay, I'm gonna try to get my heart rate up into that like 60 to 65% range for 5 minutes as I'm raking these leaves. And then I'm gonna take a rest break. There's no reason that that can't look like high intensity interval training and get your yard work done.
Yeah.
Yes.
I've heard experts say something different, Beth, and it's what you're expected in daily living to do does not mean it's exercise. So yard work, cleaning the house, doing the dishes, anything that you have to do to maintain just regular chores of daily living does not mean that it's exercise. And so I appreciate you offering this. Raking the leaves is something that we don't do every day, right? But
Yeah.
it can be challenging, and it also
Yeah.
can be really soothing to be outside with fresh air
Yeah.
and recognizing that connection with nature and also your body as you're moving.
Yeah, absolutely. And I think what you were saying about um, like we often hear about physical activity versus like exercise, and you're absolutely right. We hear that all the time. But on a really like realistic level, for any of us, again, if you're doing daily tasks, but you're doing them in a really mindful way, knowing what the research tells us and really like looking at your heart rate and looking at how hard you're working and trying to add the intensity into it,
Mhm.
anything can become exercise, right? Your walk to the mailbox, if you're adding some intensity to it, can become exercise.
Yeah. Or you walk down the driveway 10 times and then get the mail. That can be
Yeah.
exercise. Or you
Yeah.
squat 10 times before you sit on the potty. That could be
Totally,
exercise.
totally. And I will say the other spot that I like to start with people, especially if they're really, really new to exercise and maybe aren't moving a lot, is like a pedometer. And we're really just looking at like, okay, baseline, how many steps are you taking in a day or average in a week right now? And let's increase that just a little bit. And
Mhm.
that's something that I think typically would fall into the category of like, let's increase your physical activity. But that's
Yeah.
a great spot to start. If you're taking 600 steps a day right now, can we just increase that to 800 steps a day? And
Yeah.
then let's try to build that up slowly, right? So this is what I mean about like meeting yourself where you're at and creating realistic goals for what you can do today or this week. It's really important to keep that mindset because consistency is better than doing one high interval training a month, right? We want that consistency for people.
Yeah. Well, thank you so much, Beth. We are at our time and sharing your expertise with us today, and really grateful for all the information that I learned in my decade of working with people with Parkinson's. There's always something new to learn. So, Dr. Althaus, thank you so much for sharing your education and training with us, and also just dedicating your career and supporting the community of people living with and impacted by Parkinson's. I really appreciate you.
Thank you. Thank you so much for having me.
PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. Thank you, Light of Day. Now, my friends, I know there were questions in there that we didn't have time to get to today, and I am sorry. Please don't hesitate to call our helpline at 1-800-4PD-INFO. You can also email us at helpline@parkinson.org. I work with the helpline very closely. They are compassionate, knowledgeable, Parkinson's specialist. So please, if there was a question that you really would love an answer to, please call them, reach out to them. We're here to support you. All right, my friends, until soon. I hope I see you at next week's Coffee and Conversations with Dr. Sneha Mantri and her guest expert. Be well, get moving if you haven't already, and yeah, we'll see you soon. Until then.